To the last chapter of this series. I'm gonna be reading in the same way we've been doing the whole book. I'm gonna be reading in English, then translating, and the exercises just gonna be in English. So let's start with this last chapter. The last chapter is the chapter 33, that is called the urinary system. A. Urinary symptoms. Urine is formed in the kidneys and stored in the bladder until it's spaced or voided. Patients may say, I have some pain when I pass water, or I have some pain when I pee. Doctors may say, are you having any trouble with your water words? And this is a conversation between the doctors and the patients. So let's start. Doctors, are you having any trouble with your water words? Mr. Jones answered, well, I don't seem to have to go to the toilet more often than I used to. Doctor, how often is that? Mr. Jones, it depends, but sometimes it's every hour or even more often. Wow. Doctor, what about at night? Do you have to get up at night? Mr. John, yes, nearly always, 2 or 3 times. Doctor, do you get any burning or pain when you pass water? Mr. John says, no, no, not usually. Doctor, do you have any trouble getting started? Mr. Jones, no. Doctor, is the stream normal? I mean, is there still a good, strong flow? Mr. John, first shot, not quite so good as it used to be. Doctor, do you ever lose control of your bladder? Any leaking or dribbling? Mr. John, well, first shots, a little dribbling from the time to time. Doctor, have you ever passed blood in the urine? Mr. Jones, no, never. Common urinary symptoms and their definitions. Frequency. Is it dysuria? There is the burning or scalding pain in the urethra when passing urine. Nocturia is the urination at night. Urgency is the urgent need to pass urine. Hesitancy is difficulty starting to pass urine. Urinary incontinence is the involuntary passing of urine. Hematuria is a microscopic blob in the urine. B. Urinalysis. Urinalysis is the analysis of the urine. A simple screening test of the urine are carried out with reagent street. For example, a clinician's presentation of glucose. More detailed tests are carried out in a laboratory or on a specimen of urine. Typical specimens are a mixed-strain specimen and a catheter specimen. Microscope examination may reveal the presence of red blood cells, blood cells, or CATs. CATs are solid bodies formed by protein or cells. Plus signs are used in case notes to indicate abnormal feelings, and a small amount plus is described as a trace for a large amount of plus plus plus. The words gross or market can be used, for example, gross hematuria. When there is nothing, the word nil is common. And there is an example, and we can see the sugar is nil, the protein is plus, the blood is plus plus plus, or gross. And there was no sugar, a trace of protein, and gross of hematuria. So, we have to translate it. We're gonna translate it now. 33. El sistema urinario. Síntomas urinarios. La orina se forma en los riñones y se almacena en la vejiga hasta que se evacúa o se vacía. Los pacientes pueden decir, tengo algo de dolor al orinar o al pasar agua. ¿Tiene algún problema con la orina? El doctor pregunta, ¿tiene algún problema con la orina? Señor Jones, bueno, parece que tengo que ir al baño con más frecuencia que antes. El doctor pregunta, ¿con qué frecuencia? El señor Jones responde, depende, pero a veces es cada hora o incluso con más frecuencia. El doctor pregunta, ¿y por la noche? ¿Tiene que levantarse por la noche? Señor Jones, sí, casi siempre, 2 o 3 veces. Doctor, ¿siente ardor o dolor al orinar? Señor Jones, no, normalmente no. Doctor, ¿tiene algún problema para empezar? El doctor Jones, no. Doctor, el chorro es normal, es decir, sigue habiendo un flujo fuerte y bueno. El señor Jones responde, quizás no tan bueno como antes. El doctor pregunta, ¿alguna vez pierde el control de la vejiga? ¿Tiene alguna fuga o goteo? El señor Jones, bueno, quizás un poco de goteo de vez en cuando. El doctor, ¿alguna vez ha orinado sangre? El señor Jones, no, no. Ok, ahora síntomas urinarios comunes y sus definiciones. Tenemos disuria, que es el ardor o escaldura en la uretra al orinar. em, Nocturia, que es la emisión nocturna. Urgencia es la necesidad urgente de orinar. Vacilación es la dificultad para empezar a orinar. Incontinencia urinaria es la misión involuntaria. Y la hematuria es sangre microscópica en la orina. B. Análisis de orina. El análisis de orina es el análisis de la orina. Se realizan pruebas de detención sencillas de la orina con tiras reactivas, por ejemplo, clinistis. Para la detección de glucosa se realizan pruebas más detalladas en un laboratorio con una muestra de orina. Las muestras típicas son una muestra de emisión media y una muestra de catéter. El examen microscópico puede revelar la presencia de glóbulos rojos, células de pus o cilindros. Los cilindros son cuerpos sólidos formados por proteínas o células. Los signos que más se utilizan en las notas de los casos para indicar hallazgos abnormales, una pequeña cantidad, o sea, un símbolo de más, se describe como un rastro. Para una cantidad grande habrá múltiples símbolos. Se pueden utilizar las palabras macroscópico o marcado, por ejemplo, hematuria macroscópica. Cuando no hay nada, la palabra nulo es común. Ahora, una interpretación de esto acá sería, no había azúcar, un rastro de proteína y hematuria macroscópica. Okay, now, yes, it's time to read the exercises. Okay, give me a second. Okay, so, uh, okay, now we're gonna be reading the exercises. Uh, 3.1. Look at the conversation in A oppositive and complete the notes about Mr. Jones. Use medical terms where is possible. We got CO is the frequency in nocturia for 1 year. Number 3 is dysuria or 4 hesitancy. Think 5 is a strain, a little weaker, and no incontinence apart from occasional. Dry blame. Sorry. 3.2. Match the patient's descriptions of their symptoms with the medical terms. Look at A positive to help you. Okay, the first one, I have to be every half hours or so. It is the frequency. The number two is I get a scalding pain when I pass water. It is dysuria. Mm-hmm. The three is I have to get out several times to pass water at night. It is nocturia. Okay, I have to rush to go to the toilet. Is it urgency? Five, I have trouble getting started. Is it hesitancy? Six, it's I can hold my water. Is G incontinence? And seven, I put some blood in the urine. And it's hematuria. Okay, now we're gonna be interpreting this talk. And okay, 33.4. Describe the findings of the laboratory reports in words. Look at B opposite to help you. Okay, we got there was a trace of blood, gross proteinuria, and no cuts. Mr. Jones has early prostate hypertrophy. So that was all for this chapter. Thank you for your attention and see you later. Bye. Doo-doo-doo. Doo-doo-doo.